This is the story of a 34-year-old lady who came to us because no one was able to make glasses for her high myopia of minus 28 diopters. She had been using these glasses since 4 years, and on examination she accepted a whooping spherical power of minus 34 and had vision of 6 by 36 and 624 in her right and left eye. She had a myopic fundus with staphyloma and an axial length of 35 millimeters, and therefore we were a little skeptical of a clear lens extraction. On further examination, she had an average corneal thickness, but surprisingly, her anterior chamber depth on a Scheimpflug device was on the lower side, it being a 2.76 and 2.8 millimeters in the right and left eye respectively. She had open angles, and after much counseling for a second procedure, which she may need for a cataract surgery, we decided to implant the EYECRYL Phakic lens in both eyes. Since this was an unusual power, we got a custom-made lens. The power was 28 diopters and size of 12.5 was chosen according to her height to weight. I expected some difficulty during surgery, considering it would be a fat lens to implant, but as you can see, it was a smooth procedure like any other EYECRYL Phakic lens surgery. The pupil was slightly smaller, but the haptics were placed smoothly under the iris and the viscoelastic was washed off in the end and wound hydrated. She underwent the other eye in a day's time, and on post-op day 3, she was a new person who could see the world with new eyes. The clinical vault was 1 corneal thickness, and on the 15th day, we did the anterior segment OCT and found the vaults to be around 552 and 722 in her right and left eyes. The angles were open and the pressures were very much under control. What the surgery had given her was a new lease of life. She had a 2-line improvement which she never had seen in her life. She was a confident young lady who could now help her young son with his studies and finally do whatever she wanted to. She recently visited us after a year and her vision was stable and pressures controlled. There was an early start of nuclear sclerosis in her right eye, but we are observing it until the vision is affected. But at the last visit, she came with her newborn baby girl born just 2 months back, and she wanted to tell me the joy she has experienced after the phakic lens implantation. And that, to me, was a surgery well done.